definitely the most common lameness that we see today. And it often gets called other things because being busy, practitioners being busy so many times, we'll block the leg and we'll block and we don't wait as long as we should before we go higher up the leg, and so we may get a misdiagnosis. Or we're only seeing the horse in hand, or we're only seeing the horse on a lunge line and in hand. We're not seeing that horse do what they do, like jump or do flat work, dressage, whatever. And to really diagnose the most common lameness, in my opinion, you need to almost always see the horse under saddle. Because too often I will go through the early stages, long-term standing, complete flexion tests, full examination in hand and under saddle, and on lunge line, and then go under saddle and the lameness will be evident. Particularly it's not only the most common lameness that we see, it's also the lameness that is most subtle because it's in both front feet at the same time. We use the term loosely. We say the foot. The foot basically is the coffin joint and the hoof capsule, and then a fetlock being above the ankle or foot fetlock. So the condition starts there, and it's due, in all probability, as far as we can at this stage of the interpretation of what's going on, is due to a stasis of blood flow in the limb. There isn't any good blood supply down in the lower leg of the horse below the knee or the hock, so healing is slow, and there also is a stasis or backing up of blood. This in turn sets up a degenerative process in the coffin joints, the navicular region, all throughout that area, and as a result we have inflammation and pain. Fluid accumulates. That's why if you bring these horses out and exercise them, the fluid goes away and the condition improves or disappears. So many of these lamenesses, in diagnosing the foot syndrome lameness, I don't very often block these horses because I find it much better to see them warm through the lameness, see if they do warm through the lameness. Number one, by the time I've done the flexion test, done the pelt, done the hoof test, just to kind of confirm my feelings, strong feelings that say the lameness is, which 80–90% of the cases are there. So I don't want to leave that area until I'm certain. Then I go into saddle. Then I wait to see if the lameness goes away. If the lameness goes away, it means that we've got a better prognosis, obviously, because it's just not as severe, the condition. And then I know the prognosis is going to be better, so I know how to manage it better. I say that it's the most common lameness. It is the most common lameness because I do these lamenesses frequently, every day, all day. And this is, without question, where most of the problems are. So we do treat these, and this is one reason why the Ionicare was so valuable to me, and when it came forward and I started to use it, since statistically there's a lot of trouble there, I've used it a lot. And we as practitioners doing sport horses and race horses know that there is a connection when we're dealing with a coffin joint and a fetlock. They go together, and the reason being is that the horses, when they get pain in the back of the hoof, they start to dig in their toes. They're known to stumble, these horses that have this condition. And some people, for many years, have called it navicular disease, but it isn't really navicular disease. Navicular bone is only one component of the syndrome that we see. But when you change that action, you create a problem in the coffin joint. You get a stabbing action at the toe, and it works back up into the fetlock joint. So you've got inflammation now in the fetlock joint. So in the sport horses, it's secondary in the fetlock to the coffin joint, and that's how it occurs. So commonly we're treating both of those areas. So in the racehorse, it's a little different, but they create the pressures a little differently. The racehorse is galloping, and they don't do much else other than walk, jog, and canter, and most of the cantering is full gallop. So when they're doing the gallop, they land with the heel first. A horse lands heel first anyway, but in a flat racing horse, they stretch out and they land like that. In so doing, they fatigue, and as they fatigue, they do put pressure on both the coffin joint and the fetlock, but in a different way. And if you see a racing film of a horse racing, you'll see the knees down. Sometimes they run down, as they call it in racing, where the fetlock goes all the way down, into the dirt of the race track, and then and the knees back. So in racehorses, the primary sites of injury are the knee and the fetlock. But the coffin joint's always involved, so we like to play with that together in our thinking when we're dealing with the lamenesses of the lower limb. And the ankle is always very evident, the problem in the racehorse. It's not so evident in the sport horse, but the sport horse, where we commonly look for trouble with pulses, hoof testers, flexions, we can nail the diagnosis as being in the coffin joint.
Is the soreness or the pain that sort of starts this, is that usually the result of bruising or the pounding that they're taking? Or what
it isn't really specifically so much a bruise. It does occur. We do see bruising of the feet, and we treat those as acute conditions by polising them and tubbing them and that sort of approach to get the inflammation out. They have a pulse and they're positive to hoof testers, and you know there's a bruise. But the more common kind of thing that occurs is that the concussion to the foot itself, and that creates this problem. It creates the inflammation in the coffin joint and creates the synovitis, with inflammation of the membranes to the joints, and that's why they distend with fluid. So it stirs those joints up, and the fetlock does get stirred up along with the coffin joint. So when you get the concussion, that also doesn't necessarily have to be a stabbing action. It's just plain concussion, and the concussion can involve the fetlock and the coffin joint. Like in the racehorse, you get concussion in both joints of the lower limb, and even the knee.
So is it likely then that any horse that's active, you know, athletic, he's performing, racing, whatever, and he's constantly, of course, creating concussion, because every time his weight comes down on that foot, you know, there's a concussion force.
Yes.
That what happens is you're getting an accumulation of little small trauma, as it were, that is accumulating to a point that it starts to show up as a lameness problem.
Absolutely. That's exactly what's going on. The trauma is creating, and these horses will actually be positive, diffuse inflammation around the sole, the underside of the foot, and they'll be positive to hoof tester. Just a diffuse inflammation, and it's very common.
So would there be an advantage to intervening with a therapy like ionic care, even when you're not actually seeing signs of lameness, on the assumption that you're probably getting some small degree of accumulating trauma in any active horse? Yes,
absolutely. I think that the ionic care would be a very effective approach preventatively in any training situation that is a rigorous competitive kind of performance. So if I were training racehorses or training show horses, it would be very much a part of my regimen to use it in that manner.